Meds,
Dehydrated
fluids.
Love it.
What else?
Oh.
Why are we putting this in?
Blood
The doctor
transfusion.
said.
They give blood. Sometimes they take blood, right, for results. How do I know that it's appropriate to put an IV in this guy?
Orders.
I have an order, right? So I check my physician orders, I gather my supplies. That's what you're gonna see at the top, right? My hand hygiene is done. The supplies that I have is an IV start kit. In the kit, it has tape, has a Tegaderm, a piece of gauze, and a tourniquet, and a ChloraPrep for cleaning. The other supply kit, or supply item that I have is some type of lure lock device that's gonna go onto the end of the catheter from the IV itself. So this one has what's called a pigtail, where it has the extra extension tubing, or it can just be the lure lock itself. And of course I have my needle, okay, depending on what my purpose is for the IV, depends on what size IV I get, and then also the patient's size. So this is a 22 gauge, it's blue in color. And then I have a saline flush. What's the purpose of the saline flush when I put an IV in? To check patency. And also, since I do have a device that has this extra tubing on it, I need to get the air out of there, right? So that I'm not pushing air into the patient's vein. Okay, so step number one would be to explain the procedure to the patient, let them know what to expect. We tell the truth as far as it is gonna be painful, but typically just for a few seconds and then the pain is gone. Then we're gonna be looking for an IV site. So what makes a good IV site is kind of a buoyancy to the vein, right? It's not necessarily the visual, like you can see your little spidery veins in your wrists, but those are so flat that you can't fit a catheter or a straw right into them. So those aren't gonna work. So it's not off of what it looks like, it's off of what it feels, and that just takes time to learn what feels and what you're going for, okay? So finding your site and then preparing your supplies. You're going to be down to kind of one hand when you go to do this procedure, so you need all your supplies kind of open and ready so that you're not trying to do some of this when you're not. If you have a table that has had the breakfast tray on and the urine cup on, then of course you would have wiped your table clean so that you have a clean area. Okay. I'm gonna tie the tourniquet. The tourniquet needs to be tied in a manner that it can be released with one hand. And typically it's tied about 2 inches above where you're going to insert the IV at. It does need to be tight. What's the purpose of the tourniquet?
To distend the vein.
Okay, so get that blood all pooled here in the lower part. I typically wear tighter gloves when I'm doing an IV than I would if I was just cleaning something, because it helps me, for me it makes it feel like I can palpate, I can feel it more sensitive than I can. Alright, the next step is to clean. So you crack your ChloraPrep and it releases the liquid, and then we scrub. The friction along with the drying effect is what cleans it, okay? Now the step that will keep you from passing your checkoff for this next semester is if you go back and re-palpate what you just cleaned, okay? What you can do is you can palpate above and below where I poked the needle, but not where I poked the needle. If I happen to be like, ooh, that's actually where I want to poke the needle, then I need to re-clean. Okay, re-clean and re-dry. You're not being graded on whether or not you actually hit the vein, anything like that. For this checkoff specifically, you're being graded on, you know, the process, the technique, making sure that you're not injecting harmful things into their body. All right, when you look at your IV, you'll have to get close in order to do it. But the catheter, the straw, the piece of the plastic that stays inside the vein when we're all done, it does not go all the way up to the top of the needle. Okay, so there's a millimeter of needle, and then you can have the plastic straw. So you need to look at that. You need to have that visual in mind when you go to put it into the vein, because what's gonna happen first is that the needle's gonna go into the vein and not the catheter, okay? A little bit further, then the catheter's in as well. There's also a bevel, and that just means that the opening of the needle needs to be facing up towards the ceiling, so that's how you hold it. And people will hold it differently. You'll just decide what feels most comfortable to you. I hold it in between my thumb and middle finger, and then I use my first finger to project the catheter forward once I'm in. Okay. And because I'm busy chatting, I didn't even do what I said I was going to do, which is set up the rest of my supplies. So I'm going to take my Luer lock and I'm going to prime it so that it doesn't have air in there. So to release the suction, you pull back on these and then push that little air bubble out. Just drip it into your package. Okay, so now this is full of saline and not air. In real life, if you leave the tourniquet on as long as I have, you're going to cause the blood cells to break apart, right? So if I really was collecting a blood sample right now, I would need to release this, let that blood circulate back throughout his body, and then put it back on once I was really ready to go. Okay. Mr. Reed, need you to hold real still. There's going to be a big poke down in your hand. Okay. About a 45-degree angle is the typical insertion. It depends on how deep or how shallow the vein is. This one is very superficial, so I don't have to go very deep. I don't have to go very far down into the skin in order to reach it. What's going to happen first is when the needle goes in, you're going to get what's called a flash, which means you're going to see a flash of blood start to accumulate in the catheter. So I'm going to anchor the skin below so that the vein can't wiggle around as much. All right, big poke. Okay, so you start to see the blood coming. That's your flash. It's not going to bleed out because it has a air filter on the end for this type of device. So right now, the only thing that's inside the person's vein is the needle itself. Okay, remember there's that little extra bit of space. So I need to push the whole thing just a smidge further. So now the catheter should be inside the vein. And now I can thread the catheter. This mannequin skin is a lot tougher than most human skin. So sometimes you'll feel that resistance. There are people that have really tough skin from working outside all the time. All right, so now I'm about to take my needle out. Where's my needle gonna go?
Sharp.
Into the sharps right away. Some supply items will lock themselves so that it's safer, but it does still need to end up in the sharps. Once I pull the needle out, this person's blood is gonna start pulsating out of the catheter site. Ideally, you're going to put pressure above the site with your fingers to occlude that vessel. If they have really big veins or a really strong blood pressure, really high blood pressure, it's going to be very hard to occlude. So that's why you need to have your supplies ready. Because it's just flowing and flowing. Is this really bad to let the blood come out?
No. Actually cleaning it.
Other than making a mess, yeah. Other than having to clean, it's not really a big deal. Does it freak patients out?
Mm-hmm.
Yes. Okay. So, you'll just, oops, I made a mess. Sorry, I'm gonna clean that up for you.
Don't worry, it's fruit
It
punch.
also doesn't help that he's leaking around the catheter. You've been poked quite a few times. All right, so normally you would not have oozing from around their insertion site. All right, so what needs to happen now that my IV the catheter is in? The catheter is sitting inside the vein.
Yeah,
Flush it and secure it.
Okay, so I'm gonna flush it. What am I looking for when I flush it?
Make sure that it's hitting, that it's going in, no infiltration.
What would it look like if it was infiltrating?
it'd be like
Bubble.
swirling, like
All
a,
right, it would bubble up. What would the patient say if it was infiltrating? Right?
Ow.
Ow pain, right? It's actually leaking. His tough skin bent his little straw. All right, this should feel cold. No, it doesn't hurt, okay. And as you're pushing, you can feel it kind of going up their arm as well. Alright, so it looks like it's good. And Tegaderm. So you just peel the back part off. We want the, if you could stop leaking, that'd be fabulous. We want the insertion site covered, right? So, and then that way we can inspect it every time we come in the room to make sure it's good. It also holds it in place. You peel the paper off from the top and push down all the sides. Now I typically flush it again once it's all taped down, just to make sure that my taping process hasn't interfered with anything. And then I lock it. What's the purpose of the lock right here?
To prevent it from coming back out.
It's not gonna come out because of the lure lock. That's gonna keep it from like
So you
making a
don't
mess.
get blood in the lawn and it doesn't
Yeah.
clot.
Right, so you don't get blood into this. If the blood just sits there, it's gonna clot and then it won't work. Alright, so then you'll tape it different ways depending on where it is on the body. It just depends on where it ends up. I usually put an extra piece of tape here at the base to keep that closed and secure. And then I'll bring up my tubing some form or fashion to get it out from dangling around. Alright, what goes on my IV site?
Time and
Your initials.
Okay, initials, date, time. Date does go on there.
Gauge.
Oh, gauge. No, because you can see it. I don't do that. You don't know that.
I've never had anyone do that when I've had an
Me either.
IV.
Well, now you can give them the eye.
Okay.
Where's
I
your
wonder
initials?
when that was put in.
Yeah, because I've never
Alright, so what am I going to document about this process?
had a patient.
Tolerated,
Okay.
where you put it, gauge
Location.
you put in.
The flush.
Okay, that I flushed it.
Yeah.
Good. Tegaderm, right? Tegaderm applied. If I got any blood, right? Labs collected or blood collected, however you would say that. And so where are we going to document that this is at?
Right.
That's a good question.
Right.
Right hand.
Top the right hand.
Yeah,
Right
I was trying
hand.
to think of like a.
Posterior,
terms.
dorsal, you guys thinking that type of stuff? Yes, you can label all of that. That'd be great.
dorsal surface of right
All right,
hand.
questions about the process, why something is the way it is, why we don't do something?
How much saline do you push in?
It's usually recommended to do 5. If you need more than that because there's kind of an issue or something like that, it's okay.
So did you flush first 5, then last 5?
Like for when I taped it?
Mhm.
Yeah, just a few, it doesn't have to be exact.
And are we gonna be doing checkups on hands?
I don't know.
But no matter where we do it, it's going to be the same
Yeah,
process.
it'd be the-
It's just a different placement.
Yep, the process is the same. So you guys can look on your own arms or your partner's arms and kind of think what would be a good spot, what wouldn't. We don't want it to typically be in the bend, right, of any joints. Obviously, if we need a super big vein, we can use the bend of your arm, but then you're limited in
Yeah,
your
yeah.
ADLs and pushing yourself up in bed and all those types of things. Okay. All right, and we're gonna do phlebotomy later. Okay.